Hi, everyone. Welcome back to the Breast Cancer Podcast. Hello, I'm your host, Dr. DipABLM, a fellowship trained breast surgeon, and also happen to be a breast cancer survivor, thriver, and a warrior, living my best life. As you know, breast cancer affects millions worldwide, touching lives in a profound ways. Whether you're someone facing a diagnosis or a supporter seeking information or just eager to learn more, this podcast aims to be a beacon of understanding, hope, and empowerment. I'm here to talk about all things breast cancer, from surgery to survivorship, as well as high risk for breast cancer to metastatic breast cancer. My goal is to provide you with reliable information, share inspiring narratives, and foster a supportive community. I know firsthand the challenges breast cancer diagnosis brings. Throughout this podcast, I will give you strategies to handle difficulties that arise from cancer diagnosis. We'll have insightful conversations with medical experts, researchers, survivors, caregivers, and advocates. I will tackle topics that impact our lives as cancer survivors. My goal is to educate you and empower you to live your best life. I definitely have. Well, let's get started. Hi, everyone. Welcome back to the Breast Cancer Podcast. I'm DipABLM. Happy New Year. Happy 2026. It's so nice to be back here. I took a couple of months off to spend time with my family during November and December during the holidays. It was really great. I am so incredibly honored today to have Dr. Amy Comander join me today from Boston. And her credentials are simply phenomenal. So I want to read them because she is an incredible human being. And I cannot even say how grateful I am today that she's joining me. So thank you so much, Dr. Comander. So I have Dr. Amy Comander. You're a breast oncologist and a medical director of Mass General Brigham Cancer Institute, director of the lifestyle medicine at the Mass General, and an instructor in medicine at Harvard Medical School. As a breast oncologist, Dr. Comander has witnessed the struggles her patients face during and following completion of primary cancer treatment. She's so passionate. I can totally see that. I'm going to hold up the book in just a second, the book she wrote with her colleagues. It is just incredibly beautiful. She's very passionate about improving the overall health and well being of breast cancer survivors. Can I just say thank you, Dr. Commander?
Aw,
We've been
of
waiting for
course.
this book. We've been waiting for this book. Us breast cancer survivors, we've been waiting for your book. And in 2019, she launched Paving the Path to Wellness program, lifestyle medicine program for breast cancer survivors. I'm going to come and join you one of these days.
Yay.
She mentors other colleagues to run groups so that the transformational experience can be offered to a larger group of cancer survivors. I'm so incredibly excited to learn more about that because I want to bring that to Columbus, Ohio. She has co authored Paving Your Path Through Breast Cancer and Beyond, Paving the Path to Wellness Manual and Workbook, Paving a Path Through Menopause and Beyond. I'm very excited, driven to integrate lifestyle medicine in cancer care. Dr. Comander is honored to be the first oncologist awarded fellow status by American College of Lifestyle Medicine. And I'm going to put all the links to her books and her social media handles here after this show. Dr. Comander, welcome. Thank you so very much for taking the time today to join us.
Thank you so much for the opportunity. It's so great to be here.
Thank you so much. And so let's get started. So for our audience, this is also on the YouTube, so you can look at this book here. It's simply beautiful. I have highlighted so many pages. I have folded some pages because I want to go back and read it. I want to share some information with my patients. So it is incredibly beautiful. And so I want to first start asking you a question as what inspired you to write this book or co-author this book?
Thank you so much for your kind words, by the way. It was a
Thank you.
wonderful collaboration with my co-authors, Dr. Beth Brades and Dr. Michelle Tellefson. And just to tell you what inspired it, honestly, as you noted in my intro, back in 2019, which is now a long time ago, in collaboration with these wonderful colleagues, I had started this Paving the Path to Wellness program for breast cancer survivors at the Mass General Cancer Center, really focused on teaching breast cancer survivors about the role of lifestyle medicine in breast cancer survivorship. And we can talk a little bit more about what that means. And during the course of offering this 12-week lifestyle medicine-based survivorship program, it was clear that we would benefit from a workbook, really specifically focused on breast cancer, sharing how each of the tools we are talking about, again, we'll get into more detail, are
Yes.
relevant to their survivorship journey. And that's really where the inspiration from the book came from. So,
Yes.
and now
Yeah.
it's finally here. So I'm so
Yeah.
excited.
Yeah, thank you so much. The book is, by the way, is simply phenomenal and perfect. And I know I keep saying that, but it's so true. As a breast cancer surgeon, I've done this for 11 years, taking out women's tumors. I'm also a breast cancer survivor, as a lot of my audience already knows. What I have always struggled is what I do is such a technical part of the job. So I remove the breast, whether through a lumpectomy or mastectomy, and then there is the patient, comes back, and you find these people in their worst time of their life. They're already going through their life journey with other obstacles and adversities, and now the breast cancer hits them. So just doing the technical part, I always thought like I wasn't giving them everything that they need. I wanted to always treat the complete person, and this book touches on so many things. And I also want to say this book is perfect for anyone going through any adversities, by the way. I don't know if anyone has said that to you, because a lot of the components that you talk about is so applicable. Because, I see patients that are going through divorce or loss of a parent or illness of a family member. I mean, there are so many of these. You can take that and use it for your own life. So I mean, it's just beautiful.
Thank
And
you.
um, and so what does paving represent for you? Like, what does it mean?
Right. So I have to give a shout out to my amazing colleague, Dr. Beth Brady, who developed this mnemonic. So
Yeah.
paving steps is a mnemonic. So each letter stands for a topic we cover in the program, which are absolutely right. These are relevant to breast cancer survivors, but really to anyone who
Right,
wants to
right.
improve their health and well-being. So P is for physical activity.
Yeah.
A is attitude, V is variety, I investigations, N nutrition, G is goal setting, and then we have steps, which has two S's on the end.
Yes.
So here we have sleep, timeouts, energy, purpose, social connection, and stress management. So
Yes.
all of these topics are absolutely key. If we think about, how can we improve someone's health, whether it's a cancer survivor or any
Yeah.
individual looking to improve their health, really. So that's where it came
Yeah.
from.
That's wonderful. That's wonderful. And I what I loved about your book is you give so many mnemonics and so many different ways to integrate everything that you are learning in the book. And for anyone that's so overwhelmed with their diagnosis, if someone picks up this book, what should they find first?
Right. So, we've been covering these 12 topics in the Paving the Path to Wellness program offered at the Mass General Cancer Center. But I do get emails all the time from people all over. How can I participate in this program? And so, writing this book was one step to help broaden the reach of these important tools. So, I do think a person with a diagnosis of breast cancer anywhere could pick up this book and go through each chapter, taking it one step at a time. And really, I feel like I hope my goal is that it's really a roadmap for breast cancer survivorship. What are the factors that an individual can take control of to improve her health as she's navigating life as a breast cancer survivor? Because as you would just explain at the beginning, when you
Yeah.
do your surgery, obviously surgery is like so important,
Yeah.
absolutely key for treatment of
Yeah.
breast cancer, but
Yeah.
it's really what comes afterwards,
Right,
not just
right,
the therapies I offer, like the
right,
tamoxifen or the chemo or radiation, but
right.
also just living one's life after cancer. How does one move forward?
Yeah. Yeah. So how does one get involved in this program as a survivor?
Great question. So, I'm so fortunate over the past few years, since 2019, I have the most incredible team of colleagues that work with me at the Mass General Brigham Cancer Institute. That's our new name. And we offer this program to patients who come through our center. And again, a great team. And in collaboration with Dr. Beth Brady's and Dr. Michelle Tullison and another colleague, Valeria Tivnan, we now have a nonprofit that your listeners could look up, pavingwellness.org.
Okay.
And through our nonprofit, we're also hoping to offer this transformative program to patients outside of our cancer center where I work. So we're getting there, baby
Yes.
steps, one step at a time.
Yeah. And it's a 12-week program.
Right. So there's different ways of doing it. So for years, we've been doing it for offering it for 12 weeks
Okay.
to our patients outside Boston. And then, due to busy schedules and things I've noticed over the years, sometimes patients maybe prefer it given over a shorter duration. So we piloted recently doing it over 9 weeks. So I think there's different ways you could do this, but
Yeah. Yeah.
it's not totally set in stone, but it's just getting this information to patients so they can, to individuals, so they can make these behavior changes. I think whatever way you can do it, it's useful
Yeah.
and helpful.
Yeah. And so they come in person, or is this done online?
Great question. So the first time I launched this, as you noted, in 2019, it was a little conference room at our hospital that we
Yeah.
reserved. We got some plant-based food from the cafeteria, and we kind of met, and it was very lovely to be together in person and develop those wonderful social connections as we took a deep dive into each of these topics. And then COVID happened. And
Yeah.
as you know, that changed
Yeah.
everything for all of us.
Yeah.
And at that point, paving became a virtual or telemedicine type of group. So we did it on Zoom, just like we're doing this right now.
Yeah.
And to make a long story short, we've kind of kept it that way. We love the in-person component, and we try to introduce as many opportunities as we can throughout the year to bring people together. But in general, we offer the program virtually because we're able to reach such a wide range of patients this way, because people who come to our center, they could be in New Hampshire, Vermont. Sometimes people go into Florida in the winter. So we really are able to accommodate so many people by keeping it as a virtual program at this time. But we go back and forth. I wish I go back to in person, to be honest with you.
Yeah. Yeah. And I imagine people feel very empowered by end of the program because in life, I mean, as a physician, I'll be honest with you, I didn't really get a lot of training on nutrition, right?
Oh,
Like,
right. Absolutely. And that's actually, I do highlight that in the beginning of the book. Like,
yes.
our patients are
Yeah.
the ones who are our greatest teachers and ask us really great questions in our visits. Like, what kind of diet should I follow after my diagnosis?
Yeah.
Is it safe for me to exercise?
Yeah.
How do I improve my sleep habits? And I realized, like, I was trained in internal medicine, Hem-Onc
Yeah.
fellowship, the whole shebang, but did we really get excellent training in all of those domains? Not
Yeah.
necessarily. So
Yeah.
that's when I found lifestyle medicine and the American College of Lifestyle Medicine, which I'm happy to share a little bit more about that. That's where I really was able to get exposed and I took boards and lifestyle medicine to really make sure I had a good, deep understanding of all
Yeah.
of these important topics, which are so key for cancer
Yeah.
survivorship.
Yeah. No, absolutely. I actually looked it up. They offer a
Great.
program at Harvard, right?
Yeah, so well, the American College of Lifestyle Medicine is a national organization which has
Okay.
lots of great educational opportunities to learn more about the role of evidence-based lifestyle interventions to treat and prevent chronic diseases, but also, of course, to optimize health for cancer survivorship, which is how I got really interested in this. But yes, through Harvard, we have a conference. There's a CME offered in June, and actually, that's the first conference I attended back
Yeah.
in, gosh, a long time ago now, when I first
Yeah.
started at MGH.
Yeah.
I went to that conference sponsored by Harvard Medical School and the Institute of Lifestyle Medicine and learned about lifestyle medicine for the first time. And then after that, I got more involved and started attending the American College of Lifestyle Medicine meeting, which is held each year. This year, it'll be in November. And it'll be held in Orlando if you're interested. So it's a
Yeah.
great conference. So I highly recommend it.
Yeah. And I see the pillars of lifestyle medicine are nutrition, physical activity, stress management, sleep, connectedness, avoidance of substances. Now, I'll tell you, when going through medical school, we don't really get teachings on nutrition. We're not really physically active because we are either in the class or studying for hours. I was just I mentor medical students, residents, and I also train fellows. And I was just talking to a medical student. He's like, I get up in the morning at 4 o'clock or whatever time, and he studies, he goes to classes, comes back, studies some more, doesn't get to bed till midnight, then he starts over. So there's no sleep, physical
I know.
inactivity, probably nutrition, whatever he can get, and connectedness, well, your peers you're seeing if you're going to class on regular basis. Then avoidance of substances. So you're talking more about like alcohol, smoking,
Right.
drugs. Yeah.
Exactly. But
Yeah.
we remember those days. I mean, I'm guilty
Yeah.
of it myself. I
Yeah.
remember
Absolutely.
medical
Yeah.
school. I think I did get in my exercise because I've always been someone to prioritize that no matter what.
Yeah.
But you're absolutely right. I mean, and that's through our medical training. Think about
Yeah.
internship and residency and fellowship
Yeah.
are all like
Yeah.
working around the clock, and it's really hard to focus on taking care of oneself. So you make a
Yeah.
really good point. Many of us have to
Yeah.
learn this after training.
Yeah. Yeah. And I also read you run marathons.
Yes, I do. I'm training for Boston right now. I run for
Yeah.
charity. I just have to say that. So I'm
I know.
running for
That's
the LA Fund.
amazing. Yeah,
Thank
that's
you.
amazing. I saw that. You're doing it for nonprofits and for charity
Thank
and
you.
just the training itself, what it takes to get there and to run for Boston, you have to be super, super fast. I
Well,
know.
when you run for charity, you don't have to qualify for the Boston Marathon. So I just have to say that. So I am
Yeah.
not super, super fast, but thank you so much.
Yeah, no, that's amazing. That's amazing. How many months do you train for a marathon? How many months does it take you? I know you run pretty, sounds like a lot of your life. So,
Well, I'm fortunate as a member of a charity team. I'm running for the Ellie Fund. Shout out to them. We have a coach who coaches many charity teams and gives us a training plan. So it's, I'd say it's like a 16-week training plan. So we've
okay.
already started training. It's actually the Boston Marathon's 14 weeks, I believe, from this upcoming Monday. So,
Yeah.
there's a lot of support along the way and lots
Yeah.
of group runs. It's fun to run with other people, social
Yeah.
connection,
Yeah.
so I
Yeah.
really look forward to it each April. And finally, at that time, the weather here is getting nice. So that's always
Yeah.
very
That's
exciting as well. And
that's
it's great to
amazing.
run for a meaningful cause. This year, I'm actually running to honor one of my own dear patients who herself is a marathoner. She's qualified for Boston 12 times. She's run 20 marathons. Her name is Christina, so I'll have to share this with her. And
Yeah.
unfortunately, right now, she's going through treatment for her own breast cancer, so she cannot run. And I'm so honored to run for her and use her to help me and help inspire me and others because she's
Oh,
just amazing.
yeah, that's awesome. And I will say like you're practicing what you're preaching and that's a big deal, because we tell people or patients what to do and what not to do and I think it's very they get very empowered by watching you to see that you're actually doing what you say or what you recommend they should do. So that's incredible. And so as someone who's been diagnosed with breast cancer, there is a huge emotional component of being told you have breast cancer. And, I had just finished my training, had just finished my fellowship in breast surgery. And so I'm like, I felt like I put my life on hold all these years, after high school and college and medical school and residency and fellowship. And then I got hit, and I really, honestly, I did not have coping mechanism skills. So, I went through all this grieving process of like denial, anger, bargaining, depression, and acceptance. And I tell people it's very normal to go through that phase of life when you get told you have cancer, because you're not really expecting it. Is something that you're not planning on having cancer, and but you get told. What message would you give our breast cancer survivors or any cancer survivors when they get told that they have cancer?
Oh, well, first of all, I'm just thinking of you and, I'm so sorry that you went through all that at the
Yeah,
conclusion
thank
of
you.
your own training, which is so brutal. And I'm sure it was a very difficult journey, but I'm so glad to see you doing so
Thank you
well
so
now.
much. Thank you.
And that
Thank
is
you.
amazing. And
Yeah,
so, yeah, so what we try to convey, certainly to my own patients, but also through the paving program, is certainly, obviously, we don't want anyone to get a diagnosis of breast cancer or any other cancer, of course, but we do try to provide hope and the message that there are things that you can do right now to improve your health and well-being and outcome from your
yeah,
breast cancer. And that's really what our program is designed to do, like share evidence-based tools regarding lifestyle interventions that an individual can adopt to improve her health. And so we try to be just make people feel empowered and
yeah,
understand that there's things they can actively do
yeah,
no matter what their lifestyle was before their diagnosis. And we also emphasize this. I think it's always important. And I'm sure you would agree with me with your own patients. No one should beat themselves up and feel
yeah,
bad they
yeah.
didn't exercise much
Right.
before, or that they were a little overweight, or that they had 2 glasses of wine a night, or any of
Yeah,
those things, because we know the causes of cancer are complex and multifactorial, and no one did anything to cause their cancer. But
yeah.
now that we do have this diagnosis, what would the data suggest we can do to improve our overall health? And so that's really the message we try to convey. No shame, no blame, no guilt.
Yeah, no, that's such a beautiful message. That's such a beautiful message. What questions should patients be asking their surgeons, their medical oncologists, radiation oncologists when they first get diagnosed with cancer?
This is such a great question, and I'm sure you would agree. A lot of times, sometimes I see patients for second opinions. It's interesting. I understand the first time you hear you have cancer, it's like,
Yeah,
whoa, it's hard to like process any other information after that. But I do think people should really have a very basic understanding. What is the stage of my cancer? We know there are many different types of breast cancer. ERPR positive, ERPR negative, HER2 positive, like all the different
Yeah.
markers to look at. So I think a person should know her stage, know what type of breast cancer she has, know what treatments are involved, and also just understand exactly why she needs to take the treatment, how much each intervention will help improve her outcome. And then, of course, what can she do as a cancer survivor to optimize her health moving forward? And what types of programs or support are available where that person's getting care that can help her move forward? So I think those are some of the key questions to think about.
Yeah. Yeah. Yeah, I know. And I think there is this misconception out there for survivors that once they're done with treatment, it's over, it's done. And I often hear from patients that in their families and friends and the community thinks, okay, you're now done with this treatment. So you should be fine. You should be back to normal, and then they feel very alone because now the treatment team is not there with them. And they're not seeing the physicians or the nurses, the care team on a regular basis, and they feel so lost. And I really think, I mean, I don't know how else to call this other than to say Bible for the survivors, because it really talks about that. And when I was reading it, the best way for me to describe it is I felt seen and heard, and I
Oh,
hope the patients feel the same way. And I think that's really important for survivors as they go through it. Is they want to reach for resources or reach for people, but I think a lot of it is I tell people, like, we're always trying to live the best life that we possibly can. And I think this book helps you do that. And you're trying to always improve yourself. And then this book does that. But sometimes there's not people or resources out there that can help you. But I think this book, was really, it gives you that guide to kind of then carry on your life after once you're done with the treatment.
thank you so much for saying all that. That's
Yeah.
exactly why we wrote
Yeah.
this book, by the way. And
Yeah.
it's so lovely to hear your impression. And that's exactly why, to be honest, back in 2019, I
Yeah.
was so excited to launch this Paving the Path to Wellness program because you just hit the nail on the head. I would see a
Yeah.
patient,
Yeah.
let's say she's finished her chemo or she's starting her tamoxifen or whatever, and I'm like, I'll see you in 3 to 4 months. Stay
Yeah.
well. And I didn't say it exactly like that, but you
Yeah.
know what I mean?
Yeah.
And so many patients would look at me with like wide eyes and say, I don't come back here for 3 or 4 months. And I'm
Yeah.
like, well, you don't really need to. And
Yeah.
people, I mean, I'm sure you could share,
Yeah.
no,
Yeah.
that's like very, very difficult for a
Yeah.
person who's been coming to the cancer center so much
Yeah.
for so many interventions and then to feel like I don't need to come back for months. And so that's why I saw there was such a need for more support, more education. And that's kind of what led to developing this program specifically for the breast cancer survivor population.
Yeah, yeah. There are so many good pearls in this book, and unfortunately, we don't have time for a whole lot of that stuff. But one of the common things, as women and men go through breast cancer, men can get breast cancer too,
Yeah.
is fear of recurrence, right? Like,
Mhm.
you hear your friends that get diagnosed, or you hear something in social media or on news. How do you tell your patients on how to deal with fear of recurrence?
That's definitely a number one topic that comes up in
Yeah,
each paving session, whatever we're talking about. But even if it's physical activity or diet or stress management, you can be sure that that topic comes up. And I've been so fortunate to learn from so many of my psychology colleagues over the years about strategies that they've used to help individuals address fear of recurrence. And we definitely tackle that in the chapter. We have a chapter, the second letter of paving, attitude.
yeah,
And
yeah,
we do talk a lot about strategies for managing fear of recurrence. First of all, recognizing that that is a normal part of the breast cancer or any cancer survivorship
right, right.
experience. But what are some tools we can use to help with that? And I'll just share one example that we share in the book. And I learned this from one of my palliative care colleagues, Dr. Vicki Jackson, and I do mention it in the book. This concept she'll share with patients called the worry box. I don't know if you've heard this term before, worry box. So when you have a worry, like, oh my goodness, I have a mammogram in 2 weeks.
Yeah,
I'm so scared to get my mammogram, which is a
yeah,
common thing I hear. What if they find something? Some of our patients get, of course, understandably, very
yeah,
worried whenever there's a scanxiety. That's another term we
yeah,
use.
yeah.
So Dr. Jackson would say, don't you're not allowed to worry all day. So write it down.
Oh,
Say,
yeah,
I'm terrified of my mammogram and put
yeah,
it in the box. It can be a metaphorical box, but whatever.
yeah.
And then give yourself a time during your day. Maybe it's 15 minutes at
Yeah.
7 p.m., that's your time that you will let yourself worry. And then you can sit there and worry and be anxious and
Yeah.
go through whatever you wrote down, but try to compartmentalize it. I know it's easier said than done, but this is
Yeah.
one strategy that she often shares with patients. And I felt like, well, that's kind of an interesting concept. And so we've shared that one strategy when we address fear of recurrence. But of course, there are many other ways to help
Yeah.
people. And this
Yeah.
was certainly a major challenge for our survivor population, as I'm
Yeah.
sure you would agree.
Yeah, that is such a great idea, though. Even for us as, as physicians, we have, so many other stresses, in addition to, the things that our patients go through sometimes. I was taking care of my mom, not last year, but the year before. She had complications of diabetes, and, it was a lot. And then and there's so much that you can't control of the situation.
Right.
And I had like a prayer book, and I would write out my worries in the prayer book, and basically, like asking God to help me through that situation. And I did that the entire year I was taking care of her. And I went back and looked at it. There were so many things actually did not come true that I was worried mentally about different things. And so, but there's so many prayers that were answered too. And so I think it was a good way for me, journaling and writing.
Yeah,
And
that's a great example.
yeah, it was. And, and we go through it too as, as physicians. We aren't exempt for any of these things.
Right.
Now, I'll talk about one topic that a lot of my patients, for whatever reason, are young patients between, unfortunately, 30 to 50 years of age. And I hear a lot about body image issues, right? Like in America, I think we have that 75 to 80% of us suffer with body image issues. How would you counsel someone? I mean, yes, once you have a lumpectomy or a mastectomy, you change, your body changes, you have scars, you don't look the same. You're looking in the mirror, it's not the same, you're not the same person, you don't identify yourself. What are some pearls for those men and women?
Such an important question, and you're absolutely right. This comes up with our patients every single day in clinic, and of course in the paving program too. One concept that we also very much highlight in the book, because we do tackle that difficult issue, is this concept of self-compassion. And psychologist Dr. Kristen Neff has done a lot of work in this area, and it's so applicable to our cancer survivor population. Just the concept of being kind to yourself and being kind to your body has been through so much. I mean, as you just noted, as a surgeon, all the different things you might have to do to help a
Right,
patient cure
right.
her cancer or to minimize, discomfort or problems related to a breast mass. So, you know, that, so this concept of just being kind to yourself and talking to yourself the way you would talk to a good friend,
Yeah,
not beating yourself up. And I think really we talk a lot about self-compassion, and
yeah,
Kristen Neff has written a number of books, which I
yeah,
think are so helpful to anyone, but
yeah,
particularly
yeah,
relevant to the
yeah,
survivorship experience. So that's one strategy that we discussed. But you're absolutely right. It is a major issue for so many of our patients. And one of the powers of being in a paving group with other women who truly get it is if a woman does bring that up, her concerns about body image, I can guarantee you there is somebody else in that group who's
yeah,
going to say, I am with you. I have the same
yeah,
issue. And they will support each other and share what's helped them get through that. And so that's very powerful too, that connection that you see that
yeah.
emerges in these groups.
Yeah. Yeah, they were, I mean, they were really good chapters on here about body image. I was very impressed on how like that doesn't define us, our breasts don't define us. Although
Right.
in TV and commercials you see, these women with big breasts, whatnot is, considered like feminine or whatnot. But, honestly, what defines you is what you are on the inside. And I think that's the ultimate goal, is for us to keep developing ourselves, keep working on ourselves. And sometimes we may or may not have gotten the exact way to help improve ourselves, depending on what adversity we are going through, given those tools. But and I think this book really does a great job for that. So one thing I mean, I know one of your paving steps is community,
Hmm. Hmm.
right? Your social connection. And through COVID, I mean, how much social isolation has impacted women and men. And I know my mom was living by herself in Kansas, and I think she became too comfortable not
Yeah.
going out, as have a lot of patients, a lot of people around that time. And we know that social isolation is linked to, heart disease. And unfortunately, that's what my mom passed away from, heart disease. And that's a big thing for me. And I actually conducted a V Rise event. It's a survivorship event in Columbus, Ohio. For the first time, I have a
Wow.
nonprofit in my parents' name as well. It's on education. They're big about education. So I brought the survivors in the community together. We have the local sponsors to help sponsor, and I had wrote a book, and the funding from that book, or the money that I got from the book, was used in this event. And
Wow.
I had about 250 people show up to that event,
Wow.
and I had local speakers, surgeons, medical oncologists, radiation oncologists, and my good friend, medical oncologist Dr. Shabana Duani, and I co-hosted the event. And it was really so fun. And I think it was fun because there were so many questions that people had that the experts could answer, but also we ended the evening with the fashion show of the survivors. And
I love that.
yeah, it was just very touching. And I think big part of the reason I did that is education is my passion, is why this podcast is there, but also bringing the community together. It is so healing and so therapeutic. And community also reminds you that you're not alone. And there's, like you said, there's other people who are going through it. And I just absolutely love that you talk about that in your book.
Oh,
Um,
wow. I love what you just told me, by the way. Congratulations.
oh, thank you so much.
Amazing.
Thank you. Thank
And
you.
I want to read your book too.
Thank
That's so
you.
amazing. I do want to just get back to that. You're absolutely right. So this concept of community connectedness,
Yeah.
social connection,
Yeah.
whatever term you love,
Yeah.
that is a key pillar of lifestyle medicine. And I
Yeah.
will joke with you about something. When I first started doing paving, I knew it was one of the topics of the program, okay? And I kind of underestimated the importance of it. As a doctor, I was like, well, we're going to talk about all the data about the nutrition
Yes.
and physical
Yeah.
activity and
Yeah.
what did the
Yeah.
data say about stress management, et cetera. And I'm like, oh yeah, social connection, that's at the end. Well, I will tell you at the end of the program, the patients who participated in that first group, they call themselves the originals. There's a picture of them in the book.
Yeah. I
They
saw
were
that.
all like, Dr. Comander, first of all, when the program ended, they were not done. They wanted to keep meeting
Yeah.
with each other and
Yeah.
support each other and
Yeah.
continue to learn together the paving steps. But they will tell you, and I'm sure there's lots of quotes in this book from various in that chapter on social connection, that that was the greatest gift of the program. Sure, it was great to learn about exercise and
Yeah.
nutrition and all the topics we talked about, but the connections and support was
Yeah.
the most important take home from the program. So there you
Oh,
go.
yeah, that's wonderful. That's wonderful. And I think I sometimes worry, like, there's like support groups, like every hospital we have them too. I sometimes worry if someone has had a bad experience with this, say the chemo journey or whatnot, does that discourage the other survivors? And I don't know, I'm sure it probably can happen. And maybe you have to set guidelines if you're going to have like a support group of some sort. But I think there's more benefits, I think, getting together and talking about the commonalities, the suffering, the kindness, the love, the compassion is, that's as much needed as surgery or chemotherapy for this diagnosis. What advice would you give a partner or a caregiver as they're going through this?
I know that's such an important one too. And we know that getting back to that concept of connection and support, like social support for a person going through cancer treatment is absolutely key. And um, I would say to friends of mine who ask me, what should I do for my friend who has a diagnosis of breast cancer? I just usually say, just show up and do something. Like, don't ask the person, what can I do? Can
Oh,
I
yeah.
do X, Y, or Z? I'm like,
Yeah.
just do something. That person's already
Yeah.
overwhelmed enough. Just
Yeah.
show up and do something. Maybe that
Yeah.
means bringing her dinner. Maybe that
Yeah.
means calling and saying, can I pick up your kids from school? Like,
Yeah.
whatever it may be. But
Yeah.
just being there and doing something and being a good listener. I think
Yeah.
that's so important. Just someone, if the friend or the individual going through the hard time needs to kind of just
Yeah.
talk about it, just listen. And we both know that
Yeah.
that is just being able to listen. And you just said at
Yeah.
the beginning,
Yeah.
so the individual going through the challenge is feeling
Yeah.
seen and heard. That is such a
Yeah.
gift right there.
Yeah. Yeah. 100% absolutely agreed with that. Is there a chapter in the book that you felt especially connected to?
Oh gosh, well, it's hard to pick
It's
one,
hard.
right?
It's
um,
hard to pick a child. Who's your favorite child? You can't because,
I
writing a
mean, there
book.
is something about the book that
Yes.
actually I am very proud of. And
Yeah. Yeah.
actually, I will say this has been putting the book together a labor of love for a number of years. I will be fully transparent about
Yeah.
that. And what really got me to finish it was thinking about, and in each chapter, since you've looked through this, there's a live and learn. So what is that?
Yeah.
That's a reflection from a paving participant, a breast cancer survivor, about the specific topic for that chapter. For
Yeah.
example,
Yeah.
on physical activity or attitude or
Yeah.
sleep or stress
Yeah.
management or goal
Yeah.
setting or purpose. Someone shares her perspective, like a patient is sharing her perspective. And those, I think, are some of the most powerful aspects of this book. And
Yeah.
each time I read them, I'm just so inspired. So what really got me to get this thing over the finish line was like, you need to do it for your patients and all the amazing people who submitted contributions for this book. You need to get this done, you
Yeah.
know? And
Yeah.
so I'm sure you would agree that reading some of those beautiful testimonials, again, we call them a live and learn in the book, are just,
Yeah.
I think it's a major highlight of the book and major
Yeah.
strength. And I'm so proud of them and so grateful to all who
Yeah.
contributed.
Yeah. You're making an impact, and that's what that's saying to me is the impact. And I think, we all have this, longing to leave a legacy and, to contribute and to make a difference. And those stories, that's what they're saying, telling you is you have made an impact with your work. And so, yeah, I have read like each of the testimonials that they have written. And then when you read what the kind of trauma they've encountered, had with their cancer journey or other things that are already going on in their life, you just think, I have no problems in my life. I have such a good life. I have nothing to complain. And these men and women have showed so much courage and bravery in talking about it in the book. I was really impressed by that. So, I have learned so much from this book, the paving, the steps, what lifestyle medicine entails. I have some specific questions for you just about like exercise. Exercise is my passion. I'm not a runner. I do run, but it's not really like what you would call running probably. But my favorite exercise is strength training.
Go you.
Yeah. So I have actually last year started, so I get up at 4:30, go to the strength training workouts. It's heavy lifting with the barbell, but then there's coaches who help you. So you're not injuring yourself. So I do that from 5 to 6 in the morning, then I'm done. Then at 6, I take shower, I go to work. And I think the decision fatigue as a physicians, we may have to make so many decisions through the day. That's one less thing for me to worry about. So that has been amazing. And I feel so much stronger. In surgery, you have to
Amazing.
stand for hours looking down and retracting. And so my upper body definitely feels much stronger from doing that. In general, what would you quote a number for benefit of exercise in decreasing the death rate or the mortality rate? I read a number in your book, but
First of all, I'm so impressed by you. And so I just have to say, like, you don't have to run. Like, people find what brings you joy. I
yeah,
mean, we know
yeah,
the minimum is like trying to get 150
yeah,
minutes, some type
yeah,
of moderate aerobic
yeah,
activity each week, and strength
yeah,
training at least twice a week. But if you're doing more, go you. We
yeah.
know that as we get older, and particularly for breast cancer
Yes.
survivors, thinking
Yeah.
about improving muscle mass,
Yeah.
improving bone health,
Yeah.
improving metabolic health,
Yeah.
all of these things come from
Yeah.
strength training. So
Yeah.
I'm in awe of you because I
Yeah.
have to do a better job with
Thank
that. Okay.
thank you. Thank
So
you.
keep up the great work. But yeah, depending on which, I mean, there's lots of studies and
Yeah.
meta-analyses out there that certainly we cite in this book. All the references are at the end of each chapter with a QR code
Yeah.
because I think I had too many references to just put them on the book. But anyway,
Yeah.
in general, a lot of these studies do suggest that regular physical activity, meeting
Yeah.
those guidelines, really can be associated with up to
Yeah.
a 30 to 40% reduction in recurrence rate
Yeah.
and a significant decrease in mortality or dying from breast cancer. So
Yeah.
this is, just getting active. That's why we use that term, that
Yeah.
mantra, exercise is medicine or movement is medicine. We
Yeah.
know that this is so beneficial, not just for breast cancer survivors. Think about, the challenge trial that was
Yeah.
presented in June and published in the New England Journal of Medicine for colon cancer survivors, demonstrating significant reduction in recurrence risk and improvement in survival from exercise for patients
Yeah.
with colon cancer. So this is true for many different types of cancer. We're learning more and more. So I think the message is like, keep up the great work and find what brings you joy. And it doesn't have to be running.
Yeah. Yeah. No, thank you so much for saying that. I think doing anything, any type of exercise, I think, and I also someone who has taken tamoxifen for my cancer, decreases the risk of cancer coming
Yes.
back by 50%. And I think you
Yeah.
quote somewhere around the same number in
Yeah.
your
I
in
mean,
your
it's,
book, right? Without the side
yeah,
effects.
I know. I mean, also, we know that physical activity helps people tolerate their treatment
Yeah.
better and
Yeah. Yeah.
better
Yeah.
adherence, which overall improves outcome too. So,
Yeah.
all of these things are interrelated and so important.
Yes, yes, absolutely. I will say exercising did help me. Taking the tamoxifen to deal with the side effects, I didn't really feel as many because I was exercising. There's a lot of you talk a lot about nutrition, and I just loved it. I saw your pictures, all teaching culinary classes. I think that's beautiful. Do you predominantly recommend a plant-based diet? Uh, is, is
Right.
is that correct? Okay, yeah.
Yeah, so we often in our paving groups will talk about the benefits. I usually use the term plant predominant diet.
Okay,
We
okay.
we meet each person where she
Yeah.
is in terms of the
Yes.
diet changes, and I usually say think of your plate and like half the plate being filled with fruits and vegetables, a quarter some type of whole grain, and a quarter some type of protein. And of course,
Yeah.
we provide a lot of education about plant-based proteins, whether that's, tofu or
Yeah.
tempeh or beans and legumes. But of
Yeah.
course, we're not saying you can't eat chicken or fish or whatever,
Right.
but we do say
Right.
limiting red meat and
Yeah.
certainly avoiding processed meats. We do talk
Yeah.
about that a lot. And we
Yeah.
follow recommendations from, the organization, the American Institute of Cancer Research, which has lots of great evidence-based information about
Yeah.
nutrition and physical activity for
Yeah.
cancer survivors, and incorporate recommendations from the American College of Lifestyle Medicine, American Cancer Society. So we try to review all of the guidelines to ensure
Yeah.
that our patients are fully informed.
Yeah. Yeah. And I was also like the soy products like tempeh and the soy, and I do love that. I do love eating tofu and things like that, and I do think that's really helpful, especially if someone is taking endocrine therapy, right?
Right.
Is there any
Definitely.
interaction with that you know of?
Right. I mean, it's for many years there's been
Yeah.
concern, and I'm sure many
Yes.
of my patients
Yes.
have been told
Yeah.
you can't have soy, you can't have
Right.
tofu,
Right.
you can't
Yeah.
have tempeh, you can't have
Yeah.
soy milk.
Yeah.
And we know that data shows that that is not the case, that it
Yeah.
is safe to consume more
Yeah.
whole food sources of soy. So again, tofu is okay,
Yeah.
having some soy milk in your coffee is okay,
Yeah.
edamame is okay.
Yeah.
But I usually tell people to avoid some of these like concentrated protein powders that are just made of soy or
Yeah.
just made of soy protein isolate or
Right.
whatever. But
Right.
so thinking of the whole foods, but I
Yeah.
definitely think, and the studies would suggest that it is safe to have soy as a
Yeah.
component of your diet, and it's a great source of plant-based protein.
Yeah. Yeah, I agree. You also talk about supplements, which I thought was a great chapter in there talking about supplements because people do sometimes have confusion on what to take, what not to
Oh
take.
boy.
I think it's best to talk to your doctors, your providers, before you take anything, especially, I mean, you can attest to this more than that. There's interactions between chemotherapies and the different supplements, so they should talk to the physicians.
Definitely.
And my favorite thing is alcohol. Not that I drink a lot or anything occasionally, but I don't feel great anymore. And so, I'm going to limit it as much as I can this year, and that's my goal. But I mean, alcohol is not good for you. And
Right.
there's really nothing good comes out of alcohol. Unfortunately, a lot of our social settings and situations and friends you go out with, a lot of people are, drinking alcohol, but there's nothing good that comes out of it, correct?
It's true. And I think,
Yeah.
data shared earlier this
Yeah.
year shows that over 50% of Americans are not even aware that alcohol is considered a carcinogen and harmful in terms of
Yeah.
cancer risk and for
Right.
survivors. So I don't tell
Yeah.
my patients no alcohol. I just
Yeah.
say, think about why you're having a drink. If you're at a
Yeah.
wedding and having a celebration and you want to have a glass of champagne,
Yeah.
of course you should do
Right.
that. But
Right.
just
Right.
thinking about people who, I mean, some people enjoy two glasses of wine each night. Like, why are you
Yeah.
doing that? Think
Right.
about the
Right.
risk benefit of that because it's
Right.
unfortunately not good for you to do that every single night.
That is
So we
correct. That
always
is
have a
correct.
conversation, but you're
Yeah.
absolutely right. And we, of course, touch on that in this book as well.
Yeah. Yeah. You did. Of course, I've talked about so many things I love about this book, but I
Oh,
really loved the coach approach. I've
hmm.
never
Yeah.
actually thought of it that way, but it's really interesting. You take any different topic that you're talking about, and you apply this coach approach for listeners. Can you
Yeah.
elaborate on that? Because I loved it. I loved
Well,
it.
I have to give a shout out to my colleague, Dr. Beth Brady's, who she came up with that. So she's the queen of the fun mnemonic,
Yeah.
okay?
Yeah.
And just thinking about, and I think that's another important concept I want to highlight in our book. Like, we all know, you and I know,
Yeah.
like when I started paving, you could say, I'm going to give a lecture about physical activity. I'll give a lecture
Yeah.
about nutrition.
Yeah.
But actually, when it comes to behavior change, it's
Yeah.
not just so simple for the doctor to just like
Yeah.
give a PowerPoint presentation. We
Yeah.
have to work with each person
Yeah.
and think about what is going to help each individual make
Yeah.
these behavior changes. And that's where the
Yeah.
concept of coaching comes in. And actually,
Yeah.
I was really fortunate over the pandemic
Yeah.
through our hospital. I was able to get trained as a health coach. And
Yeah.
actually, it's a totally different set of skills than what we learn as doctors when we're like used to telling someone what to
Yeah.
do.
Yeah.
Coaching is really like, again, finding what's meaningful to the individual,
Yeah.
helping them create a vision for themselves or how they're going to get there.
Yeah.
And that's why I actually quickly pulled up one of the examples of the coach approach. I think this is
Yeah.
the physical activity chapter. So at the end of each chapter, we share this mnemonic from Dr. Beth Brady's and
Yeah.
take each topic and give examples for how the person reading the book can think about coaching themselves
Yeah.
to make that change. So again, what does the mnemonic stand for? C is for curiosity,
Yeah.
O, openness, A, appreciation, C, compassion. There we go, compassion.
Yeah.
And H, honesty. So going through each topic in the book, whether it's physical activity, attitude, whatever it is,
Yeah.
thinking about how can you make a specific change, setting a goal for yourself, a SMART goal, which we talk about in the book as well, and going through this coach mnemonic to help sort of
Yeah.
drill down on how you're going to make that change
Yeah.
that's important to you. So I am glad that you noticed that, and I
Yeah.
loved including that throughout the book too. And
Yeah.
again, grateful for Dr. Beth Brady's for teaching us
Yeah.
all that.
Yeah. I think it's really great. Also, I mean, this can be applied in so many places, I think, in life in general.
Mhm.
If you have some sort of a conflict at work or at home, and I think this is a great way to look at this, to have an openness to whatever the topic is, and to appreciate the other person, to have the compassion and be honest. Like I just think. I think it's really a good mnemonic to use to be a good human being, I think, in general, because it's so applicable for so many. I'm like, this is fantastic,
Aw,
because
thank you. I love it
sometimes,
too.
yeah, and
Yeah.
sometimes you like, not necessarily an argument, but somebody is given a debate and you may or may not agree with their point of view, but then you can be compassionate and kind and disagree. And I think this is a great way of doing that. So, yeah, I mean, I cannot get enough of this book. I'm going to probably read it 2 or 3 more times. I'm going to
Oh,
memorize the
you're so
book.
funny. Thank you so much. Oh,
um,
actually, can I share a
yes,
quote? Since I opened my
absolutely.
book,
Yeah,
this is
absolutely.
from one of my dear, dear patients who
Yeah,
love the paving program so
yeah,
much. In
yeah,
fact, when you go through the book and get to the chapter on energy, her name is Mary, and she shares many brilliant insights in the energy chapter. But there's a quote that she shared with me to include in the book, and I just have to read it because it is
yeah.
so special to me, and I want to give her a shout out. So she says, I had an aha megawatt light bulb moment. Cancer is difficult in so many ways. The paving program and process gave me hope. Now, no one mentioned that, and for me, it might have been the most important benefit of all. Not the red thread, but the golden thread that ran through it all. Wow, that sure was a cathartic realization. So Mary's so,
Oh,
so brilliant. I'm so
yeah,
grateful to her. But it is true. People will tell you they just felt hopeful after
yeah,
going through the program and feeling like they had control over things they could do,
yeah.
move forward. And that's just such a beautiful thing.
It is a beautiful thing. I think, being told you have cancer, you lose so much control, and you are enabling the survivors to take control back with this book. And I think that is like the biggest take home is there is so much control you can take back in your own hands. And I think you talk about that. Yeah, and that actually talks about that is, and we that never really have control in our life, but we think that we do. But being told you have cancer, we completely lose control. But I think this is an incredible book. What should you say to someone right now? They feel scared, they feel exhausted, they're unsure of what's going to come next. Why should they pick up this book? I mean, there are a million reasons we just talked about, but is there like one thing or two things or three things that stand out in your head?
I know. Well, first of all, getting
Yeah,
back to that concept we
yeah,
talked about earlier, self-compassion, be
yeah,
kind to yourself. Don't
absolutely.
recognize,
Yeah,
as you just beautifully stated, this is
yeah,
a very hard time being told you have
yeah,
cancer. It's one of the scariest things you can be told. So just
yeah,
take a deep breath, be kind to yourself.
yeah,
And then I'm going to share another quote that I love, but
yeah,
it really resonates with me, especially in the new year. A journey of 1,000 miles begins with a
yeah.
single step. And that's from the
Yeah,
Chinese philosopher Lao
yeah,
Tzu. And so just thinking about that, just take
yeah,
the first step. What
yeah,
can I do to move forward?
yeah,
It may be a baby step, but just taking that
yeah,
first step
yeah,
and you'll get there. And just
yeah,
think that that's
yeah,
what I would share with someone.
yeah,
And of
yeah,
course, give them a copy.
yeah, yeah. The first step is take the first step and then be consistent and then show
Right.
up every day. Anything else you want to talk about?
Well, I'm so grateful to meet you. I mean,
Yeah,
that's like
thank you.
acknowledge like the power of, social media and
Yeah,
podcasts to
absolutely.
share these
Yeah,
important messages. And I
yeah.
just want to like express gratitude to you for all you do to empower the community of breast cancer survivors and other cancer survivors around the world. Like, wow, let's just recognize
Oh,
that.
thank you.
And
Yeah.
so I'm just grateful to meet you. And thank you so much for inviting me today.
Thank you so much for being here, for taking the time and, giving up time on with your family on a weekend. I really appreciate it. And I really highly recommend, people getting this book. I'm going to put a link of this book in my social media handles.
Yeah.
Um, so people can go, where to go to get it. It's available on Amazon. And Dr. Comander, you are an incredible human being, and what a gift you are to this world. So thank you so much for joining me today.
Thank you so much.
Bye, everyone. Thank you for joining us today. And it's an honor that you took time out of your day to listen to this podcast. And feel free to give a 5-star rating if you like it and share it with your family and friends. And hope you're having a good start of the year. Until later, see you later. Bye bye. Thank you, everyone, for tuning into the Breast Cancer Podcast. Remember, you're not alone in this fight. I encourage you to be an active part of this podcast. Please share your stories, questions, and suggestions for future topics at my website called drdipahalaharvi.com. And please share this podcast with others, especially if you found it useful. And please also give it a 5-star rating, if you will. Stay connected as we navigate the complexities of breast cancer. Until next time, take care and keep shining brightly. Disclaimer: this podcast is not intended for complete medical advice, so please talk to your medical professionals.